Treatment areas are first marked before the procedure. We mark volume reduction areas while avoiding risky zones. The treatment mainly targets contouring and volume reduction. Younger patients with firm skin usually do not need aggressive tightening. If skin laxity is severe, tightening can be combined with volume reduction. This is the typical treatment range most commonly used. Entry points are selected based on tip length and treatment range. I prefer treating a wide area through a single entry point. For larger double chins, thicker tips may be used, but thin tips are usually enough. This patient is young with good skin elasticity, so the outcome should be excellent. Cases like this often show noticeable improvement even with minimal treatment. Local anesthesia is first applied at the entry point. This is typically the most uncomfortable moment during the procedure. Next, sufficient tumescent solution is injected. Tumescent solution improves comfort and RF energy delivery. Adequate infiltration reduces pain and improves outcomes. You may feel something moving under the skin at first, but it gradually fades. After infiltration, we wait briefly before treatment. The cannula is advanced in the subcutaneous plane and should move smoothly when correctly positioned. You may feel movement beneath the skin, but severe pain is uncommon. The area is thoroughly sterilized and treated under aseptic conditions. The device is typically set at 30 watts and 50 degrees Celsius, then moved slowly. The opposite hand continuously checks the cannula tip position and depth. If it feels too hot or uncomfortable, adjustments can be made immediately. Smooth movement means the cannula is safely staying within the fat layer. Each area is usually treated for about 2.5 to 3 minutes. Using longer treatment time instead of higher power is generally safer. Most patients experience less discomfort than expected. Usually, it only feels mildly warm. As energy is delivered, tightening gradually develops in the skin and fat layer. The device automatically monitors temperature and stops if overheating occurs. It also stops automatically near muscle or superficial skin layers for added safety. With proper tumescent infiltration, the procedure can be done without sedation. Most patients report minimal procedural pain. The cannula tip is continuously monitored by hand to stay in the correct plane. Interest in cannula-based monopolar RF is growing significantly at international conferences. In areas like the double chin, softened fat can sometimes be expressed after treatment. In more significant cases, liquefied fat may be expressed in greater volume. Even the finest tip can deliver excellent results while minimizing the size of the entry point. Small entry points usually require only simple taping afterward. Another major advantage is safety. The most common concern is nerve or vascular injury. So far, we have not experienced complications related to nerve or vessel injury. The device includes an automatic cutoff safety system. If the temperature rises excessively or the tip approaches the wrong layer, energy delivery stops automatically. The system also becomes unstable if the tip is not positioned properly within the fat layer. The cannula itself is blunt rather than sharp. Even if it contacts vessels or nerves, it tends to glide past them instead of piercing them. Minor bruising can occur, but serious vascular or nerve injury risk is very low. The device may automatically pause if it approaches nerves or vessels during treatment. Overall, the system is designed with strong safety features. Swelling is expected immediately after treatment, but usually improves within a few days. This procedure works by melting and promoting absorption of fat through RF energy. Greater fat reduction effects are often seen in body treatments than facial treatments. Facial treatment focuses on natural tightening and subtle volume reduction. Results are usually evaluated after about 3 weeks. By then, swelling subsides and collagen remodeling progresses. Additional treatment can be performed after 3 to 4 weeks if needed. Thank you for watching today's live procedure.